Welcome back. This is SaharaTV. My name is Karen Atia. Last year, global population hit 7 billion people. A significant proportion of the world's future population growth will come from developing countries in Africa. It is estimated that Nigeria's current population of 160 million is expected to grow to 400 million by 2050 and 700 million by the end of this century. In a speech last month in Abuja, the Daily Times reported that President Goodluck Jonathan announced that he was considering birth control legislation. He said in order for the government to come up with the, quote, regulations, guidelines, and laws, Nigerians must be made to know that they cannot continue to procreate and procreate. He stated that the National Population Council would work to sensitize uneducated Nigerians about birth control before introducing legislation. However, many religious leaders, both Christian and Muslim, have criticized the suggestion that birth control is the answer, citing that it runs contrary to many Nigerians' religious beliefs. Does Nigeria have a population problem? And if so, is birth control the answer? Joining us to talk about it today is Dr. Koye Oyerinde, an assistant clinical professor at the Mailman School of Public Health at Columbia University. He implements the Averting Maternal Death and Disability Program strategies on maternal and newborn health worldwide. Dr. Oyerinde received basic medical training in Nigeria and underwent graduate studies in general public health and epidemiology in Nigeria and South Africa. So thank you so much, Dr. Oyerinde, for joining us on SaharaTV.
You're welcome.
So to start off with, does Nigeria really have a population problem?
Well, yes, there is a population problem. The population is growing too fast, and it's quickly going to exhaust the carrying capacity of the earth. And, we are fast outstripping the social services available for the population. So I agree with President Goodluck's premise that Nigeria has a population problem. But I strongly disagree with his solution to the problem.
Okay, and we will definitely get into that. But even I have here that average birth rates in Nigeria are about 5 to 6 children per woman currently. Has this been traditionally the trend? Is it on the rise? Is it falling?
If you look at across the entire country, there's a trend toward gradual fall in the fertility rate, right? So we're having a gradual fall in the fertility rate. But you then need to break that down and look at urban women versus rural women. Mm-hmm. There isn't that much fall in the fertility rate amongst women in rural areas, amongst women who are uneducated, amongst women who are poor, amongst women who are in the informal sectors of the economy. So even though the general trend is the downward trend, it's too slow, and it's not a universal trend towards lower fertility.
Mm-hmm. Now, you mentioned earlier that you agreed that Nigeria has a population problem, but you didn't necessarily agree that birth control legislation was the answer to that. Now, why do you think that birth control legislation is not the answer?
Well, let me go back the historical vein and say that there was a landmark conference called the ICPD Cairo 1994. That's almost 20 years ago. The ICPD is the International Conference on Population and Development. And before that conference, the world was concerned by the high population growth across the world. Mm-hmm. But the focus at the time was on the fact that women were having very high fertility, they were producing too many children, and the solution was to curb women's fertility. Mm-hmm. So we focused on family planning. We're looking at monitoring the fertility rate. And what did the world have? A very prescriptive and top-down approach to population control. Now, at the ICPD conference, the landmark conference in 1994, the hallmark of that conference was that it brought population development, reproductive health rights, all into the picture to say that you cannot take women out of their social context. Mm-hmm. You cannot take women and isolate them from what their culture demands of them. So, not really a woman's problem that the population is growing so fast. It's a social problem. It's a problem that beyond just the woman. It's the problem of the society in which the woman lives in. Mm-hmm. So we cannot curb population growth by legislation. If you look back, look at the countries that have tried it. So you have apartheid South Africa. Mm-hmm. Oh, let's sterilize all these women in the township, and so that they don't produce too many children and overrun society. So, of course, the women rebelled. People were hiding away from health facilities. People were dying in large numbers. Up to today, there's a huge sense of distrust of the health system as a result of that policy in apartheid South Africa. Look at even the U.S. Let's sterilize all the women who we think are undesirable elements in society. Mm-hmm. And of course, they focus on minorities of the community, right?
Right.
Of course, the minorities do not want to then use health facilities. Mm-hmm. So in every place where you've tried all this legislation as an approach to population control, what we've had is a backlash from the community. Mm-hmm. They say, no, that's just isolating one aspect of my life, and you're legislating that against it. Right. Let's look at China, one-child policy. They were able to reduce population growth, but there are over a billion, 1.3 billion people now in China.
Sure.
Okay, and what's the effect of the one-child policy? Infanticide.
Yes.
Girl children are being killed. Female fetuses are being aborted. Now you have a lopsided population in China.
Yes.
Too many men, too few women. I'm sure that's not what President Goodluck Jonathan wants to happen in Nigeria.
No, definitely not. And surely, he mentioned also in his speech, some of the reasons that you brought up already, historical examples of birth control legislation being used to sterilize undesirable elements, being used specifically to target minority populations, has led to a distrust in top-down approaches of installing birth control legislation in other countries. But what are some other reasons that birth control legislation might still be a very sensitive topic in Nigeria and Africa, for that matter?
Well, of course, the one of the things that Africa has suffered over 300 years of colonialism, slavery, and apartheid, mm-hmm. and the health system in these countries tend to look more like something that's foreign. The formal health systems were established by the colonial governments, and in some sense, they have a parallel existence from the traditional healthcare system that's running in villages and rural areas. So when you then have these kinds of policies coming from government, what it reminds people of is the colonial mm-hmm. apartheid era, when all these policies came from some foreign government in London or France or somewhere like that, mm-hmm. and it's coming controlled population so that the interest of the West is served, but they don't look at the interest of the African population that is bearing the brunt of this policy.
Sure. And what about the religious aspect of the dissent with the birth control legislation law?
Come again.
The religious aspect. There have been a lot of people who have been upset by President Jonathan's statements, saying that Nigeria is a deeply religious country, and with most of the population being either Christian or Muslim, their beliefs would not at all support any sort of birth control legislation.
Well, there's a religious angle to everything in our life. You know, there's always a religious angle to everything. But it's just a cop-out here. It's an excuse for the government to do nothing meaningful. Mm-hmm. So let me give you examples of two countries. Bangladesh is a predominantly Muslim country. Over 80% of the population of Bangladesh is, Muslim. Mm-hmm. But the contraceptive prevalence rate, right? The number of the proportion of women aged 15 to 49 using modern contraceptive methods. Okay? 48%. 48%.
Wow. Okay.
But it's a predominantly Muslim country.
Mm-hmm.
Let's look at Nicaragua. Nicaragua is a predominantly Catholic country. Mm-hmm. Over 80% of the population are Catholics, Roman Catholics. Mm-hmm. Okay? The contraceptive prevalence rate is 69%.
Okay, wow.
Almost 70% of women, urban, rural, wherever they are, use contraceptives.
Mm-hmm. So religion does not have to be a barrier to effectively introducing birth control into a population, as we've seen in Nicaragua and Bangladesh.
Exactly. And then when you look people within Nigeria, look at the urban women in Nigeria, whether they are Christians or Muslims, they have access to proper reproductive health. Mm-hmm. So if you ask them, I'm sure many of them use contraceptives.
Mm-hmm. So the problem is more so education and access.
Yes, it's a matter of. So the question is, what's the value of birth control to the rural woman? Mm-hmm. She's not part of the formal economy. She doesn't have to work. She doesn't need maternity leave. Mm-hmm. She works on her farm and gets her produce and sells on the roadside. So she needs a large family. She needs children who can work with her on the farm. Mm-hmm. So, good value for her to have many children.
True. Yes.
But if you're an urban woman working in a bank in Lagos, you can't afford to have kids every other year and then go on maternity leave every other year. Mm-hmm. Your career will be severely at risk.
Yeah.
So you'd rather have one child, maybe every 2 to 3 years. And by the time you have 3 children and the cost of caring for them, after school care and, preschool care and all that, mm-hmm. is expensive. So you naturally curb your fertility.
Right.
But that's you deciding to curb your fertility, and you're going out to seek help. Mm-hmm. So you're going out to look for experts who can help you with your fertility.
Yes. Now, another criticism that I've seen from our users, our viewers on Facebook and Twitter when it comes to the birth control legislation is that perhaps that this is telling people to manage their families is a cop-out or is a way of absolving the government of their responsibilities to properly manage and allocate resources. President Jonathan said that Nigerians should manage their families first before the government should make clear policies. Now, is telling people to manage their fertility first in a way putting the cart before the horse? I mean, shouldn't the government always be thinking clearly of their policies and how to manage resource allocation?
Well, I mean, that kind of statement coming from the presidency, tells you the level of incompetence in that office in Nigeria. When you have a president who thinks all you need to do is legislate and people will fall in line. So it comes from the tradition of military government in Nigeria. You know, President Jonathan has lived through 30 years of military government. So even though we have a so-called civilian government there, you know, the legacy of our military past means that everything, they always want to say everything has to be based on some kind of legislation and give the order, and people must fall in line. Well, that's not the way democracy works, and that's not the way the real world works. The approach to population control that I think they need to look at is to focus on development, real development.
And what would real development be?
Yes. So when you give every child in Nigeria functional education, this is not people just going through schools and getting a useless certificate that doesn't enable them to participate in any formal economy. Okay? Functional education that allows kids to work and grow in his or her profession. So if you have all girls in Nigeria, imagine that all girls in Nigeria have functional education. Then it is only natural that the fertility will decline drastically, because they have to work, they have to take care of their children, they soon become urbanized, they lose access to their extended family networks because they're now in the urban area. So naturally they will cut their fertility. But you don't need legislation for that.
So you're saying that the answer is not legislation, but rather development, and especially in the way of educating girls, is the answer to, or at least a potential remedy to Nigeria's development and population issues that it will face in the future.
Exactly.
Great.
So you have a government that avoided the discussion about development and putting the blame now on women. Let's curb their fertility. It's not a matter of their fertility. Their fertility is a symptom of the lack of development. So you don't treat the symptom, you treat the disease. The disease here is lack of development. People are not. People are being kept at a level of the last century.
Okay.
Their access to care, their access to reproductive services is way back, like it was in the 1960s.
Right. Okay, Dr. Oyerinde, all right, I think that is a great point to end on, that yes, that the government needs to stop avoiding the conversation about development and needs to properly focus on education, and particularly the education of women, so that we reverse what this trend is of blaming women for the lack of development and putting, again, the onus squarely on the back of the government. Dr. Oyerinde, thank you so much for joining us today. It was lovely to have you on the show, and we hope to continue the conversation about birth control in Nigeria and in Africa later today, or later on. Thank you for joining us. Okay, everyone. So again, that was Dr. Oyerinde talking about birth control in Nigeria. My name is Karen Atia. Stay tuned for more from Sahara TV.